Hi, my name is Dr. Radhika Rampat. I'm a consultant cataract and refractive surgeon from London, UK, and I'm extremely excited to welcome today Dr. Guillaume Debellemaniere, who is also a cataract and refractive surgeon based currently in Tahiti with a beautiful background there. And he is, in fact, the D in Pearl DGS, the main developer of Pearl DGS. And he is not only an amazing clinician, but he's also an innovator with a special interest in machine learning. So welcome, Guillaume.
Hi, thank you for inviting me.
And I'm going to get straight to some questions on IOL calculations using AI. So, Guillaume, why would you recommend AI-based IOL calculations to those who are not already using it?
So that's an interesting question because it's a very broad subject that we hear a lot about in congresses. I think we should first define what is AI. And when it comes down to the IOL calculation topic, in fact, AI boils down to regression because basically the eye is quite boring, statistically speaking, and your experience shows that you don't have to use very advanced AI techniques to correctly predict what happens in the eye. So I would say that the most important thing, in fact, is using modern IOL calculation formulas like Pearl DGS, but also like EVO, Kane, and Barrett, because those formulas use optics at their maximum capabilities, but they also use regression techniques to predict what can't be measured or calculated. So I think the most important point is to use proven and advanced IOL calculation techniques.
And what do you think is the main selling point? I mean, is there an actual clinical impact of using these new IOL calculations?
Yes, it does, because when you look at most papers, you can gain up to 0.1 to 0.2 diopters of standard deviation in diopters, which is huge, in fact, because you can add 5 to 10 percentage points of eyes within the 0.5 diopters error category, which is really a huge clinical impact.
Brilliant. I think that what you've summarized there is that not only should we be using AI-based and modern IOL calculating formulas, but we should also be appreciating that there is this clinical impact, which is going to directly translate to patient care. And so I'm really excited to use these in my practice. I already do. And I hope that everybody watching this on iDoc Social will use it too.
Yeah, and it's especially important for complex eyes or post-refractive patients in which the prediction error is usually higher. And those formula really take their biggest interest in those cases.